Ed, thanks so much for joining us. I appreciate you being a good sport and coming on the program. How are you this afternoon?
Good to be with you, Dana. Thank you. You bet.
So tell me about this Gallup poll that shows that only 37% of Americans actually approve of Obamacare, and this is even a percentage point lower than when this poll was taken back in January of this same year. The negatives seem to be at all-time highs. Why don't more people like it, Ed, if it's working so great?
Well, it only affects a small group of people in the country when you look at the number of people that have health care. But that Gallup poll also says that 7 out of 10 people who have gone through the exchanges have no complaints and are satisfied. In fact, they rate it as either good or excellent. So it's a mixed bag. It's not perfect. It's going to be years before this thing works itself out. And I don't think that Obamacare is perfect, but I think for the start of it all, it's starting to do what was originally intended to do.
What was it originally because I know you and I kind of disagree on this
Sure.
a little bit. What, in your opinion, was it designed originally to do, the Affordable Care Act?
Yeah, and that's a great question because I don't think it's really asked enough in the conversation across America, Dana. Healthcare, we had so many people who were uninsured, people going to emergency rooms and running up the cost for the rest of us who are on health insurance. So to bring the cost down, the goal of Obamacare was to get more people covered. And quite honestly, the majority of those people are poor, people who can't afford health care. And these are the people that didn't have coverage, that were going to emergency rooms, that were driving up the cost. So the overall philosophy of Obamacare was to get poor people coverage, to give them an opportunity. Also to make sure that there wasn't going to be any discrimination, that if you got sick, you weren't going to get dropped. And if you were sick, you were still going to be able to get insurance. So those were the three main things that Obamacare tried to do. It's not perfect, but I think when you look at it for a year and you look at the weekend enrollment of over 100,000 more people, I think it's a pretty good start.
Well, I know when it first kicked off, there were more cancellations than there were enrollments, and the Associated Press had reported, they published a table which showed that it was about 4.7 million. Some had projected 5. I think the real number is about 4.7 million fewer people had been insured because of it. And you and I, when we were discussing these junk plans, what you say are junk plans, and that's why you had all of these cancellations, and you said that the health insurance policies that were canceled as a direct result of ACA, that those policies, they just didn't meet the criteria of the law. But when I look at the criteria, they had 10 points, Ed, that they wanted health insurance companies to follow in terms of offering these policies. I just don't understand how it's better for someone, for instance, elderly people or single men. Why should they have to pay for things like maternity coverage or pediatric care if they don't have children? That's like that one size fits all that seems to just be an added cost that they shouldn't have to foot. What do you say on that?
Well, that's a good point, but you can a la carte out everything about somebody's insurance. There's certain things they don't like. There's certain things about my insurance that I certainly wish were better, and my wife has gone through cancer. But all in all, it's been a financial savior for us. I think the big thing that what Obamacare did was bring standards into the marketplace. And the insurance industry agreed with this. They agreed that they were going to have to meet certain standards if they were going to sell insurance. So the term junk insurance to you, Dana, might not be junk insurance to me, or vice versa. It's a term that's been thrown out there and used. But the fact is that now we don't have limits on policies. The fact is that there are standards that the industry has to meet, which the industry agreed to before they got into this. So there was a great deal of give and take between the industry and the White House and the people who were negotiating this to make it work. And that's really where it came down. So there are people out there who had their insurance dropped that had no problem with it. Most of them were healthy and never had to exercise it. The mistake that the president made was, and it was a crucial mistake in the explanation of Obamacare, is that if you like your insurance, you can keep it. Well, that's simply not true. That was an inartful way to explain something because there were standards that were put in place that forced people to get insurance that would have new standards which the industry went along with. So that was really the big move.
You said something about a la carte, which I agree with you on the point that I think that we should be able to tailor our health care and our options to what our needs are. For instance, I bring up the fact that, in those, going back to the junk policies, those standards, those mandated standards, everybody has to have the exact same insurance coverage, basically in order for the whole thing to work. But wouldn't it be so much better if we would be able to, like for instance, if I wasn't planning on having any more children, why would I need maternity coverage? Why couldn't I just not have that as part of my insurance plan?
Well,
why can't we approach it that way?
The truthful answer to that, Dana, is that it has an element of socialism to it. We're all going to contribute in to make sure this thing works. There's certain things that I pay for that I don't like, but I understand for the greater good and for the good of the country and to bring costs down and to get more people covered. In the long haul, it's going to be good for all of us. And as I prefaced at the beginning of our conversation, it's not perfect. And this is part of what might get fixed by this new Congress. They may come in and adjust certain things, and I'm encouraged by the fact that President Obama has said that he's willing to make some adjustments to the law. And this is what it's all about. The Republicans now have the control. It's now their chance to come in and fix what they believe is wrong with Obamacare. But throwing the Affordable Care Act out and repealing the whole thing, I personally think would be a step backwards. There's a lot of positive things that have happened. And there's a lot of imperfections that I know that our government can fix to help the private sector, for that matter.
One of the things I wanted to ask you about, and this was from our discussion last week, when we talk about the greater good, I feel like so much of the conversation, Ed, focuses on health insurance as opposed to health care. Is it really improved care? Because Forbes and Wall Street Journal and a number of Medicare actuarians have even discussed how we have fewer options, and yet it's going to be, especially after these new premium rates kick up, it's going to be exponentially more expensive. And it seems as though we are all settling for mediocre care and playing a numbers game when we could really do things to have genuine better care.
Yeah. Well, my answer to that is that the insurance industry is clearly a major player in our healthcare system. We still have a for-profit healthcare delivery system in this country. Other countries have decided not to go down that road and allow government to play a greater role. I think that you can strike a balance. I think that someone should have the freedom to go out and purchase the kind of insurance that they want to do. And our system allows us to do that. But I also think that, and I'm in favor of the mandate, I do believe the more people we get covered at a lower level, the better off we're going to be. I don't think that it's America, and I think we all have to be our brother's keeper. I believe that we all have to care about our next door neighbor. I don't want to see my neighbor go broke because he gets sick. I don't want to see him lose his home because he gets sick. I don't want to see her lose her job and have to,
Is government the best way to do that, though?
Well, the private sector hasn't done it, and that's the real problem. And I understand people's rates are going to go up. My rates have gone up, but the rate of increase is much lower now than what it has been over the last 20 years. And I know that liberals love to beat up on the Bush administration, but wait a minute. We've seen health care costs go up all the way back to the Clinton years.
And they're going up still.
And they tried to do something about it, and it didn't happen. But we have seen, if I have my numbers correct, almost 10 years of double-digit increases for most Americans. And it simply was breaking our back. And I think that one of the things that the proponents of health care reform started listening to what Mr. Gates was saying when he was the defense secretary, talking about the biggest problem that the Pentagon was going to have was going to be the health care delivery system and paying for it. And so I think we were at a breaking point in this country. We had to do something. Is it going to be the same 5 years from now? Probably not. Are we going to move? Is the pendulum going to swing to something better? I believe that it will.